talk about a mistake that is so common and seems so innocent, you might have literally done it this morning without a second thought. But for millions of people, it could be making their medicine completely useless.
You know the scene, right? You've got to take a pill, so you grab a nice, healthy glass of milk to wash it down. I mean, what could possibly be wrong with that? Well, what if I told you that for some of the most important medications out there, this exact habit could be sabotaging your entire recovery? That's right. This one simple act could render a powerful antibiotic almost totally ineffective. And today, we're going to break down exactly how this happens, why it's so dangerous, and, most importantly, how you can easily avoid it. Okay, so this all comes down to something called a drug-food interaction. And honestly, it's a huge issue in medicine that most of us just never really think about. And it turns out antibiotics are one of the types of drugs most sensitive to what you eat and drink with them. When the wrong antibiotic meets the wrong food, the result is pretty straightforward. The drug just doesn't work as well. You're swallowing the pill, you think you're doing the right thing, but your body isn't actually getting the medicine it needs to fight off that infection. So what is actually happening on the inside? It's not magic, it's just chemistry. Let's dive into the science of a process called chelation. Now, chelation sounds super complicated, but the idea is actually pretty simple. It's a chemical reaction where metal ions, in this case the calcium from your milk or yogurt, literally grab on to the antibiotic molecule. They link up, they bind together, and they form this brand new, much bigger, and kinda useless chemical structure. Here's the best way to think about it. The calcium acts like a pair of handcuffs on the antibiotic. It snaps right on, completely trapping the drug molecule and basically stopping it from ever doing its job. And once those chemical handcuffs are on, the new complex they formed is just too big and clunky to be absorbed through your intestinal wall. So that medicine you just took, it can't get into your bloodstream to go fight the infection. It just passes right through you. Okay, so which specific antibiotics and foods are we talking about here? Let's get right into it and identify the main culprits you need to be looking out for. Yeah, this is super important. This interaction doesn't happen with all antibiotics. The two main classes you really have to watch out for are the tetracyclines, that's things like doxycycline, and the fluoroquinolones, like ciprofloxacin. The good news? Some of the most common ones, like amoxicillin and azithromycin, are generally okay. Now let's look at the food side of things. The most obvious source of calcium is, you guessed it, dairy. We're talking milk, cheese, yogurt, even ice cream. All of these can cause that chelation problem with those specific antibiotics. But here's the thing, calcium can be sneaky. It hides in places you might not expect. Lots of common foods, like orange juice or breakfast cereals, are fortified with extra calcium. And of course, there are the non-food sources. Calcium supplements, many over-the-counter antacids for heartburn, and even your daily multivitamin can have enough calcium to cause a real problem. And believe it or not, it gets even broader than that. This isn't just a calcium issue. Other common minerals can cause the exact same handcuff effect on these antibiotics. We're talking about iron, magnesium, aluminum, and zinc, all of which are really common ingredients in supplements and antacids. So what are the actual real-world consequences of this? Well, this is where a simple little mistake can become truly dangerous, not just for you, but for all of us. So how big of an impact are we talking about here? Get this. When taken with calcium, the absorption of some of these antibiotics can be reduced by up to 90%. 90! That means you're basically getting only a tiny fraction of the dose your doctor prescribed. Here's what that looks like inside your body. See, for an antibiotic to work, its concentration in your blood needs to get above that effective dose line. But when chelation happens, that level gets completely flattened out. The drug just never reaches a high enough level in your system to actually kill the bacteria. And the results of that are pretty serious. First, you get treatment failure. Your infection just doesn't get better. That means you're sick for longer. But the biggest danger, the one that affects everyone, is that when you expose bacteria to these low, non-deadly doses of an antibiotic, well, that's the perfect recipe for creating antibiotic-resistant superbugs, which is a massive global health crisis. Okay, so after all of that doom and gloom, I've got some really good news. This problem is 100% preventable. Let's walk through the simple, practical steps you can take to make sure your medicine actually works. All you have to do is remember 3 simple rules. Number 1. Always take these specific antibiotics with a full glass of plain old water, nothing else. Number 2, create a time buffer. Avoid any dairy or calcium-fortified foods for at least 2 hours before and 2 hours after you take your pill. And 3, if you take supplements with calcium, iron, or those other minerals, just take them at a completely different time of day from your antibiotic. And, the most important step of all is to just talk to your doctor or, even better, your pharmacist. You're not expected to have all of this memorized. The next time you pick up a prescription, just ask one simple question. Is there anything I shouldn't eat or drink with this? It's a pretty powerful reminder of how a tiny, seemingly harmless habit can have such huge consequences. And it really leaves you with an important question. What other simple little things in your daily routine could be quietly affecting your health?